Good morning, just Mr. Joe Snow. I'm gonna go ahead and provide your privacy here. There we go. Alright, perform hand hygiene. Got my gloves. How are you this morning? Are you doing good? Fantastic. Alrighty. Now, I'm going to need you to show me your beautiful fancy little wristband. Right here, let's see if I can get my glove to go on my finger this morning, sir. All right, can you tell me your name and date of birth? All right, everything matches here, fantastic. All right, are you in any pain this morning, sir? No, okay. Well, before I start assessing you, we're gonna move you up to a working height. We're gonna make sure you're in a semi-Fowler's position with your head up a little bit. Bring our side rail down so I can start assessing you. Are you in any pain? You can just show me with your fingers, scale of 0 to 10. All right, 0, that's fantastic. All right, I'm gonna hook you up to a pulse ox. I'm gonna listen to your lung sounds real quick. I'm gonna make sure I'm listening to all 4 lobes of your lungs. And I'm gonna count your respirations for 30 seconds. All right, everything looks all good here, sir. All right, if at any time throughout the procedure, if you're having trouble breathing, if you're in any pain or you need anything, just hold up your fist. Just stop me and I'll make sure I address whatever you need, sir. All right, let's get our table here ready to be used. All right. Normally I would have a chucks pad, but since we don't, we're gonna pretend this is our chucks pad for today to make sure we keep y'all nice and clean. All right. I'm gonna go ahead and make sure we have everything opened and ready to go. Bring our cups over here. I'm gonna open this, and it's brand new, so we don't have to lip it or anything. Pour in some water, brand new hydrogen peroxide we're gonna pour in here. I'm gonna just move these out of my way. All right, so we have everything set up for you. You're nice and oxygenated. Everything looks good, ready to go. All right, sir. So I'm gonna remove your oxygen. I'm gonna stabilize your appliance, and I'm gonna remove your old cannula. All right. Now, normally I would discard this at this time, but since we don't have an additional one to replace it with, we are now going to pretend that this is my new sterile cannula. I'm going to lay this over here for use at a later time. I'm going to continue to stabilize. I'm going to remove your old dressing now, sir. All right. Now I'm going to remove my gloves and discard all of this and go ahead and perform hand hygiene again. All right. Now we're going to go ahead and get ready for the sterile part of this procedure. Put on my sterile gloves. Slide some of this up a little bit. Sure you're keeping sterile technique. All right, here now we got all these ready to go. We're gonna go ahead. Let's see here, we don't need you, we can discard you. To our trash, we can discard you. And we can discard you as well. All right, now we're gonna insert our new cannula. And with one hand, I'm gonna stabilize, and with the other hand, I'm gonna put the cannula in. Make sure the latches clap, all right. All looking good, sir. All right, now we're gonna take some Q-tips this in our solution. Making sure we're cleaning from the stoma out. We're gonna do one swipe with the first cotton tip on the bottom, discard, get our next one, do one side of the appliance, discard. Each time making sure we're doing one stroke from the stoma out. We're gonna do the top, discard, and then we're gonna clean the side and discard. All right, now you're all nice and clean. We're gonna go ahead and we're gonna dab you dry. And we can discard that as well. All right, now we're gonna get ready to put on your new clean dressing. Stabilize with one hand and try to put this through with the other. All right. Now we have your nice new dressing on. I'm gonna go ahead and remove my sterile gloves. Discard those for hand hygiene. I'm gonna put on my new gloves and I'm going to call my assistant nurse Addie to help stabilize your appliance while I change your collar. And we are going to pretend for demonstration purposes that she also has a pair of gloves on. We have limited supplies, so she doesn't, but we're going to pretend for demonstration purposes that she does. Now we're gonna go ahead and we're gonna grab our collar string. All right. We're gonna remove one side. We're gonna feed this down through. Make this about half and half and try to get a lot of these kinks out. All right. Bring the old collar down. We're gonna bring you up and through. All right. We're gonna finish removing the old collar. We're gonna discharge this behind us. Then we're gonna lead through here. And then we're going to tie this in a square knot over here. Very nice. And we're going to make sure we can fit one finger in here. You can let go. We're going to put his oxygen back on. Through the entire time he's had good oxygenation. We can fit a finger in here. Can you move your head comfortably, sir? All right, you can. Fantastic. We're going to remove our checks pad as well. Discard that. All right, are you in any pain right now, sir? So you're on the pain scale. Fantastic. All right, ox still looks good. We're gonna listen to your lung sounds, making sure we're listening to all 4 lobes again. Okay. And while I was doing that, I'd also be checking his respirations. Count those for 30 seconds, multiply by 2. Those are all good as well, sir. All right, I'm gonna put your bed rail back up, roll your bed back down. All right, so oxygen's on, you're all comfortable. Bed's back in a low position. Everything's cleaned up. I'll take the rest of my supplies with me. Respirations are good, everything's good. We're gonna make sure his call bell light is in reach. Is there anything else I can do for you today, sir? Okay, I'm gonna remove my gloves. Once again, I'm gonna perform hand hygiene. All right, you have a good day, sir.